Okay. All right. Basically, right now I'm in day 4. Okay, it's been 4 days since I've had the surgery done, and I still have the contact lenses that they put on there to protect the cornea after surgery for the PRK. Yeah, it's discomfort. It doesn't feel comfortable for the most part. Obviously, LASIK is a much better choice for most people because they can have LASIK done, as LASIK doesn't have as much healing time. Most people can walk out of the chair after having LASIK done, and they're a couple of hours, they're back to work and that. If you're planning on having PRK done, I would suggest take at least 3 days, maybe 4 days, because this is a process. It's not something I think that you could just, at least for me, I couldn't just go right back to work. So, really depends on the individual. But one thing's for sure, I can see a hell of a lot better than I did before without glasses. I can see what time it is. I can walk to the bathroom at night without worrying about killing myself. And, I mean, before I could only see 6 inches past my face to read something. After that, everything was just a blur. Couldn't even make out faces or images that well. It was just everything was very, very blurry. I had a real high cylinder stigmatism, and even with glasses, I was getting maybe 20/60, and so I was very close to not being able to even drive a car because of the fact that it's hard past the DMV and that. So yeah, there's a lot of advantage in doing the PRK, I think, especially if you qualify to do it. It's a bit unnerving to have somebody work on your eyes, do LASIK or whatever else. But after going through the experience and going through the toughest part of this, which is I would say the first couple days, you get used to how things work. And as soon as I get my contacts off, my healing contacts are kind of like a bandage over your cornea, then I know, of course, my vision will even improve. As is right now, I can sit there and I can pick up my iPhone right now and I can actually read emails, which they told me I probably wouldn't be able to do without reading glasses. So that is very encouraging to me. I can see across the room. I can focus on whatever the time, look at billboards. Um, they were saying I'd probably have about a 20/80 vision improvement. I think it's a lot better than that so far. And they say it'll get even better. So far, I'm pretty encouraged, considering ever since I was a kid, I wasn't able to still see past 6 inches without some sort of help in glasses. And this is very encouraging. However, like I said, if you plan on having it done, make sure take preparations, have somebody available to help you out with things, because the first couple days are definitely the worst, and you really can't do a whole lot. So. If you want to see how the surgery is performed, it is on YouTube, on some of the other sites. If you just look up PRK Surgery, you'll see it. But for the most part, yeah, if you qualify to do LASIK I think is a much easier healing procedure. But if you have high cylinder stigmatism like I do, and you have things that indicate that it needs to be done this way, then I would suggest definitely go to your doctor or your eye care professional and talk to them about it, what your options are. And I'm not a doctor. I'm just obviously just someone who had it done. So I can't give you legal advice, obviously, or advice on on what kind of doctor to see, whatever. But all I know is it works for me, and so far I've been very, very pleased in that. But for the most part, that's about it. Can't think of anything else. But the thing is, keep in mind too, something I forgot to mention, you will be taking antibiotic drops that they'll give you afterwards. Those are taken every 6 hours. I had to take. Also, I had to use a tear like Oasis almost every hour, to keep my eyes wet. And you're going to be sensitive to light up until about, even to this is a fourth day for me, I'm still light sensitive. And that does go away, after a couple days more. So probably about the fifth or sixth day it'll go away. The other thing is you definitely want to keep some wraparound sunglasses, because it is really hard to function outside. If you go outside without some real dark wraparound sunglasses, like an Oakley or something like that. What else I'm trying to think here? Of course, I've been taking Ambien at night, which they prescribed as well, which was a lifesaver. I mean, you just have to do that. And one of the other sections I also showed you that I had the goggles, which you have to wear at night to keep from scratching your eyes when you're sleeping, because you'll do things like that and not realize you're doing it. And the contacts really have to stay in place. The longer the contacts stay in place, the quicker your eyes will heal. If those contacts drop out in the first day or so, it'll take longer for your eyes to heal, and you'll be in more pain. So you want to keep the contacts in as long as possible. And that is a little tricky. You just can't touch your eyes. You want to touch them, you can't touch them. One thing I found for pain relieving, the best pain reliever I found so far was literally, like my doctor suggested, just take a washcloth and kind of lightly damp it, put it in a freezer, and just lay it over your eyes. Don't push it against your eyes, just lay it over it. And the coolness from that washcloth really, really helps. And because they do give you drops, and they refer to them as magic drops, and they're supposed to be like numbing drops and keep the pain away, but slows down the healing process. And my understanding is that would take you from possibly a 4-day healing process to maybe a 7-day healing process if you keep using them. So I didn't see much benefit in waiting longer to heal, so I didn't use them at all. Instead, I just used the damp cloth and put them in the freezer, and just take them out, probably 4 or 5 times a day, lay them over my head, and the pain just goes away. So, you could do it with the drops they give you, or you could just do it some other way. But for the most part, it certainly is up to you how you want to do that. You'll just talk to your doctor on whatever works for you. But for the most part, would I do it again? I'm sure that's a question some people are wondering. Yes, I would do it again in a heartbeat. To be able to see across the room and walk and function like normal people. The most exciting thing that has happened to me today, I think, is grabbing some of my old glasses, that I have. As a matter of fact, hold on one second. I loosely refer to these as my Elvis glasses, as you can see, And you can also probably, if I get another thing here, the thickness of that lens is just enormous. But, and, now I can't even see them anymore. That's amazing. But that's a thick lens, let me tell you. Look at that there, man. Isn't that incredible? So, we do these here. You just don't need these anymore. So, that's all there is to it. Plus, donate that to a worthy cause, because I don't need them anymore, thank the Lord. So, anyway, that's all I wanted to say. I'm going to sign off. It's my 4th day in this, and feeling pretty good. It's better than what they described to me, so I'm very encouraged. And so I'm signing off. Thank you very much.